What is a health disparity? The National Institute of Health defines health disparities as gaps in the quality of health and healthcare that mirror differences in socioeconomic status, racial and ethnic background, and education level. From that definition alone, it seems as if studying health disparities would be an ordinary task. However, narrowing down the exact causes of health disparities has proven to be very difficult, which is why health disparities are still very popular in research. Minorities have suffered more from inequalities in health and healthcare than any other group. Here are some examples of healthcare disparities that affect minorities. One group I'd like to focus on is the Black population of Lumpkin County, specifically the disparity in coronary heart disease mortality compared to that of whites in Lumpkin County. When compared to counties nationwide, Lumpkin County, with the CHD mortality rate of 126.2, is 0.3 away from being in the bottom quartile for coronary heart disease mortality nationwide. When compared to state mortality rates, blocked coronary arteries have a mortality rate of 102.1, which is nearly twice the state's rate of 55.8. In terms of racial and ethnic disparities, data is more difficult to find. Because the Black population in Lumpkin County is so small, making up only 1.8% of all Lumpkin residents, while whites make up 95%, many organizations find it difficult to collect accurate and representative data. For example, when calculating mortality rates, Georgia's Department of Public Health's Online Analytical Statistical Information System, otherwise known as OASIS, gives the number of deaths due to coronary heart disease in 2013 by race. Whites in Lumpkin County had 57 coronary heart disease deaths, yielding a mortality rate of 194.1. Blacks in Lumpkin County had only 3 deaths from coronary heart disease in 2013. Rates based on numbers less than 5 will not even be calculated by OASIS, but my personal calculations based on deaths and population yielded a mortality rate of 584.4. In addition to rates not being calculated by OASIS, the Census Bureau has many datasets that do not even give values for blacks only. In some cases, the Census Bureau does not collect certain data from the county as a whole, and only state information is available. Now that a disparity is recognized, it's time to determine why this specific disparity exists. First, let's go over some of the factors that affect one's health. Based on the socio-ecological model, there are 5 levels that make up someone's environment: individual, interpersonal, organizational, community, and policy. The individual level is pretty self-explanatory. It reflects the choices made and actions of an individual and the effects their actions have on their health. The interpersonal level includes the direct relationships people have, such as friends, families, coworkers, etc. The organizational level includes all organizations someone is involved with, such as schools, workplace, hospitals, parks, and so on. The community level includes the indirect relationships as well as the direct relationships a person has. Finally, the policy level consists of policies that affect a person and their health. This can be federal or local law, or even a workplace policy, such as no smoking. African American culture and systematic racism are just 2 of many things that contribute to disparities. To begin with, non-Hispanic blacks are the most poor of any ethnic and racial group in the United States, with an astounding 32.9% of non-metro residents living in poverty. Poverty has been linked to obesity, which is a top risk factor for coronary heart disease. In addition to that, racism by both peers and healthcare workers has led to what some researchers call psychological invisibility. One study in particular has shown that physicians held an implicit prejudice against their black patients that led to different diagnoses as well as different treatment plans for patients with similar or even identical conditions based solely on race. In addition to that, there have been some community events that perpetuated the culture of racism that is so prominent in our country. In 2010, 6 students dressed as KKK members for a class project, and while some were appalled at the incident, others were not so surprised. One woman said, "This town is racist. It's been going on here before my time," and immediately withdrew her son from the high school. Between racism from physicians, whether implicit or explicit, and racism from students and peers, psychological invisibility has led to a feeling of exclusion from a community that should be available for support and approval of minorities. Overall, the effect of racism on health and healthcare is detrimental and severe, As a whole, individuals, communities, organizations, and governments should all work together to create a more accepting and nurturing environment for people of all races, genders, ethnicities, sexualities, education levels, income levels, etc. If these issues are not addressed, gaps in health and healthcare will continue to widen and present even more problems for the oppressed.